Dr. Peter Glidden here with you, fresh back from my annual sojourn into the land of continuing education credit. I was with Dr. Wallach in Seattle, Washington for the annual American Association of Naturopathic Physicians conference, where we were securing the necessary continuing education credits to maintain the integrity of our licenses to practice medicine. And boy, oh boy, if you thought I had no respect for the MDs a week ago, my respect for them has fallen to an all-time new low. While I was at the annual American Association of Naturopathic Physicians, as irony would have it, let me say that once more, at the annual Naturopathic Physicians medical conference, I was lectured to on 4 separate occasions by MDs. MDs, right? Can you imagine Dr. Glidden sitting in the audience with MDs lecturing him about stuff that I learned 30 years ago and delivering me this information with an attitude as if they had just discovered it, as if they were, the end-all, be-all of medicine. The hubris of the MD is without bounds. There was, however, some pertinent information that I was able to pull out of the conference, and I'd like to share some of that with you now, and it concerns cancer. I was exposed to an article at the annual Naturopathic Conference called The War on Cancer by Ralph Moss, who's a PhD, and his website, cancerdecisions.com, cancerdecisions.com. Here's a little statistical evidence, another little arrow in the quiver against conventional cancer treatment. Let me bring you up to speed. Here's what Dr. Ralph Moss, PhD, says. Linus Pauling, PhD, in a jacket for Dr. Ross's book, The Cancer Industry, Linus Pauling wrote this introduction. Quote, "Everyone should know that most cancer research is largely a fraud, and that the major cancer research organizations are derelict in their duties to the people who support them." Unquote. That's Linus Pauling. Two Nobel Prizes, and there's a backstory here that I'll go into in a future date. But Linus Pauling was the person whom Watson and Crick, the discoverers of DNA, Linus Pauling, 5 or 10 years before Watson and Crick came along, proposed a double helix model of the double helix design for the structure of DNA before Watson and Crick got their hands on it, and they basically ripped him off of the double helix stuff. They proved that it was a double helix, but Linus Pauling, years before them, advanced the first notion that DNA actually was a double helix. Linus Pauling, arguably one of the heroes of the vitamin movement, the vitamin revolution in the United States. But poor Linus Pauling didn't even know everything there was to know about vitamins, because when you take massive amounts of vitamin C, it inhibits your body's absorption of the mineral copper, and if you don't have enough copper, all kinds of bad things happen. And if you look at pictures of Linus Pauling in his later years, he was a walking, talking advertisement for copper deficiencies. But I digress. Let's go on and read a little bit more about this Dr. Moss's article on cancer. Lead time is the length of time between the point at which a cancer is detected by modern tests and the point at which it would formerly have been clinically detected. Lead time bias extends the statistical length of a patient's survival without necessarily prolonging the duration of life. Now, here's what that means. Years ago, before they had super-duper laboratory tests to detect the presence of cancer, you didn't know you had cancer until the tumor was visible, right? You had no idea that you had cancer. But now, they can detect the presence of cancer at microscopic levels. They can detect the presence of cancer years before it actually festoons into a noticeable, palpable tumor. So when you look at cancer survival rates from one particular vantage point over the last 10 years, you can see the cancer industry would have you believe that people are living longer now than they ever did with their cancer, and cancer research people say that's because of treatment, but it's not. It's because of lead time bias. People are dying just as much and as often and as soon from cancer as they always had, but because we can now detect cancer 4 or 5 or 6 years before we could previously, it gives the illusion that people are actually living longer with cancer. How about that? Like the fellow said, you don't know what you don't know. Lead time bias accounts for much of the illusory improvement seen over the last few decades in treating breast, prostate, and a few other kinds of cancer, wherein the patient population has increased greatly. Patients are actually dying from cancer with the same regularity, but the statistics look a whole lot better. Isn't that interesting? You know, this is the thing, folks. Unless you have scientific training, unless you have some type of experience with research and with statistics, it is extremely easy to be hoodwinked. It is extremely easy to be fooled. It is extremely easy to be misled because, let's be honest, when someone with an MD or a PhD starts talking statistics, most of us, our eyes roll back in our head. We automatically genuflect at the altar of the higher intellect of the PhD or the MD, and they could tell us that eating dog poop would be beneficial for us, and most of us would do it, right? You know, because we really feel inferior intellectually. We feel inferior intellectually, and there's no reason that we should. Statistics is just another thing, you know. I mean, for goodness sake, if you can cook, chicken cordon bleu, if you can cook up a nice croque monsieur, if you can do a good job with gourmet food, you have just as much intellectual acumen as anybody with a PhD or an MD. And really, we really culturally just need to get over it and stop giving people with more academic education a pass because they don't deserve it. Now, I'd like to read a little bit more from Dr. Moss's War on Cancer article. By the way, I'm reading this from the Townsend Letter. The Townsend Letter is a decades-old magazine for the alternative health community. However, the Townsend Letter, in my opinion, is going the way that naturopathic medicine is going. It is becoming more or less nothing than green allopathic medicine. However, this particular article stands out as tried and true, holistic, good, rational, holistic science, which there's very little of these days. Drugs approved for lung cancer. The article goes on to say that the last 40 years have certainly seen the introduction of numerous anti-cancer agents for lung cancer. We're going to specifically talk about lung cancer here because this is the type of cancer that most people, it is the leading cause of cancer deaths in the United States. More people die from lung cancer than from any other type of cancer. In the past decade and a half, the Food and Drug Administration has approved the following for first-line treatment of non-small cell lung cancer. Navalbine, paclitaxel, gemcitabine, and docetaxel. In addition, docetaxel was also approved for second-line treatment. We are repeatedly told by the FDA that these drugs lead to a statistically significant improvement in survival, usually as demonstrated through 1 or 2 randomized controlled trials. What we are less often told is that the overall survival benefit of these drugs is in the realm of 6 to 8 weeks. Crudely put, the patient trades some serious toxicity from the cancer treatment for a mere 1 to 2 months of increased survival. And yet the way that the oncologist pitches this to patients, the way that the cancer industry pitches cancer treatment to us is false and misleading and completely confabulates the truth. You think politicians lie? Well, right next to them in the bigger the lie, the better the lie, are oncologists. The research that they use is skewed. The results that they use is skewed. There's built-in bias that nobody talks about. The unsuspecting patient has no idea The doctor tells the patient that there will be a 25% increased success rate if you try these 2 drugs, and what they mean is you're going to live for 2 more months. But in the meantime, the quality of your life is going to be so unbelievably poor, you won't be able to recognize your kids, all your hair is going to fall out, your teeth is going to fall out, we're going to need to stick a tube down your stomach so we can feed you because you won't be able to swallow on your own. Oh, that's just great. And we let them do it to us. We let them do it to us. And when we hear in the news that somebody else has died from cancer, you want a reality check? Pick up the newspaper, the Sunday newspaper, and read the obituaries. Just read the obituaries. The majority of people that are dying, they listed their cause of death in the obituary, that their obituaries are written out in the paper. It's cancer, it's cancer, it's cancer, it's cancer, it's cancer, it's heart disease, it's cancer, it's cancer, it's cancer, it's cancer, it's heart disease, it's cancer, it's cancer, it's heart disease, it's cancer, it's cancer, it's cancer, it's heart disease. Very rarely does somebody just die of old age anymore. Wouldn't that be great, just to die of old age? And yet, even though we are faced with such a massive amount of treatment failures, right? Almost $1 trillion has been spent on cancer research, and we aren't any closer to a cure than we ever were. In the next couple of weeks, we're going to have Dr. Jim Sensenig, one of the leading naturopathic physicians, the standard bearer for true, honest, and naturopathic, holistic naturopathic medicine with integrity. He has a private practice in Connecticut. We're going to have him on the show, and he's going to tell us about cancer treatment that was all the rage before chemotherapy got its grips on the industry, and the remarkable success that he and a handful of other physicians in New York City are having with this one old-fashioned cancer treatment. You're going to love it. Stay tuned. Holistic medicine's going to the dogs, ladies and gentlemen. The naturopathic profession is listing heavily towards the MDs, believe it or not. Those of us in the naturopathic profession who are holding fast to old-time naturopathic fundamental philosophical beliefs, e.g., the human body has the ability to fix itself, e.g., the human body wants to fix itself. The only thing necessary for the human body to fix itself most of the time is to give the body the nutrients that it needs, help the body to eliminate its waste, stop eating foods that are harmful to the body, and secure enough antioxidants every day to get the job done. This is fundamental, straightforward, old-fashioned naturopathic medicine, and those of us who hold these positions are now considered radicals in the naturopathic community. It is unbelievable to me. You know, thank God for longevity. Thank God for Dr. Wallach, and thank God for a handful of my colleagues, my stalwart colleagues, who are holding fast to naturopathic principles in the face of this unbelievable prostitution of the profession, leaning more and more towards this weird, hybridized, green, allopathic, integrative baloney. Ladies and gentlemen, if you want science-based, clinically verified, science-based, clinically verified, alternative to drugs and surgery therapeutics, which have been clinically verified to support and promote the body's ability to fix itself, then you have come to exactly the right place. And sadly, there are less than 50 naturopathic physicians that I can recommend with a good conscience that you go to see. Longevity is going to save medicine in the United States. Longevity is the only way that you can secure your health realistically, unless you happen to live in the same town as one of the, 50 or so real naturopathic physicians in this country. We are now becoming the minority inside of the profession. This was an eye-opening week for me. I feel like I need to be in mourning for what's happening to the naturopathic medical profession. I cannot recommend that anybody see a naturopathic physician anymore unless I have vetted them. It used to be if you graduated from a naturopathic medical school, life was good. And I could just easily say that if you had paid those dues, that you had an education in the basic fundamentals of holistic medicine, and, I'm good to make a recommendation, but not anymore. I do not like the way that the schools are going. I do not like the way that the education is going, and quite frankly, that ship's going to sink. unless something dramatic changes. So what are you going to do? Are you going to lean on the American Association of Naturopathic Physicians? No. Are you going to lean on naturopathic medicine specifically? No. You should lean on Dr. Wallach and Dr. Glidden and a handful of our contemporaries who are learning Dr. Wallach's health recovery methods. Because Dr. Wallach's health recovery methods, ironically, are the most holistic in the world right now and certainly the most effective. And remember, folks, healing is easy. It's not some complicated, sophisticated technological process that only has to happen inside the bowels of a multi-million-dollar high-tech MD-directed facility. Healing is easy. You just need to learn the fundamentals. And we can teach you the fundamentals for a one-time $10 membership fee. Join Youngevity, $10. Become a member of Youngevity, and we will teach you Dr. Wallach's health recovery protocols. You don't even have to become a member to have access to them. Just call us up. Give one of my associates a call. That number, toll-free, 855-347-3696. That's toll-free, right? 855-347-3696. 855-347-3696. Give one of my associates a call, and they will hook you up for no consultation fee. No insurance copay. We will tell you what Dr. Wallach recommends you do in order to support and promote the health of your body in the face of a diagnosis by an MD of whatever it is that you have. It's that easy. Really, this is a revolution, and I have doubled down in my dedication to help Dr. Wallach spread this information as quickly and as far and as wide as is humanly possible, because I just came from this morning. I was lecturing at a senior citizens health expo, and oh my God, there was a big hall of vendors, right? And my Youngevity booth was right next to the cremation booth, and right down the hall there was a reverse mortgage booth, and right down the hall from that there was a how to optimize your medical insurance booth, and everybody marching through that place was sick and suffering. Everybody marching through that place was taking at least 5 prescription medicines, and even though they were taking 5 prescription medicines, they looked like death warmed over. It's going to happen to you unless you change. It's a foolish person that does the same thing over and over and over, expecting a different result. Pay attention to what we have to say, and you will live long and prosper. Ladies and gentlemen, I'm Dr. Peter Glidden, and you have found your way to fire your MD now. Give me a call if you'd like to speak about all things medical, 866-582-9933. That's toll-free, 866-582-9933. Once more, for the statisticians out there, 866-582-9933. We're going to go right to the phones now with Al, who has a call back with an update on his headaches. Al, you are live with Dr. Glidden. Welcome back.
Oh, thanks, Dr. Glidden. I followed your protocol saying what to keep track of what you ate and that stuff. The problem is I'm waking up with headaches.
You are. So What did you have for dinner, right? You want to pay attention to what you had for dinner
right.
That night, right? You finding any things in common?
No.
Oh, not at all?
Not at all.
All right. So,
I thought it might be chocolate or something, and I quit chocolate, and I still have the headaches. So.
Yeah, okay. So are you only getting the headaches in the middle of the night?
I usually wake up probably early morning, like 4 or 5 o'clock, and then when I get up like 6:30 or 7, I still have the headaches. So.
And how long has this been going on, Al?
This has been going on for like 2 years.
Is that right? And was it subsequent to anything? Was it, you've been getting headaches ever since you moved into that new house? You've been getting headaches ever since you retired, or was there anything related to the appearance of the headaches?
No, I had to go on disability. I thought it was because I was a pharmacy tech, so I had, was on the computer for a lot, but I thought that was it, but that's not it at all. So.
And what was the nature of the disability?
It was a combination of I have Klinefelter syndrome, osteoarthritis, and then the headaches.
Okay. So has the stuff that I've recommended that you do helped at all with the osteoarthritis?
Yeah.
How much?
I couldn't even barely get my hand behind my back to, scratch my back. Now I can go all the way up pretty well between my shoulder blades. So.
Yeah, okay. So if the pain that you had from the osteoarthritis before you talked to me was a 10 out of a 10, what is it now?
Well, maybe a 1 or a 2.
All right, very good. Okay, and how long have you been doing this?
May 23rd is when I started this year.
Okay. Oh, holy smokes. So not very long at all. All right. So here's the deal. Now, what part of your head do you feel the headaches in when they happen?
Usually in the front, or right around the temples and that.
Yeah. And does the head pain? What's it feel like, Al? Does it feel like your head's exploding? Does it feel like someone's pumping a balloon up inside your head and it's going to burst? Does it feel like someone's squeezing your head? Does it feel like someone's hammering your head with an ice pick? What's it feel like?
Kind of like the pumping up.
Pumping up. And is the headache, is it steady or is it throbbing?
It's pretty steady.
All right.
I mean, it goes away once in a while during the day, but, you know.
All right. Okay, so it's like a steady pain. It's not like a throbbing, pulsating pain, right?
No.
All right. And when you have the headache, what makes it feel better and what makes it feel worse?
Sometimes when I lay down and that, it helps. They gave me some medication that to take. Once in a while, it may take the edge off it, but, you know, it doesn't last for very long.
How about a hot application or a cold application?
You know, I've tried like the ice pack on the head, and it doesn't do nothing. So. And
does putting a warm, a hot or a warm towel on the head do anything?
No.
So neither, right?
Right.
All right. So when do the headaches happen? Is it always in the middle of the night?
It's late. It's probably 4 or 5 o'clock. You know, I usually go to bed about 9:30.
Yeah. And then you wake up.
4 or 5. I wake up with them sometimes, either early in the morning or by the time I get up, I usually have a good headache. So.
Okay. All right. So I have one more card up my sleeve in this domain. Okay. There's a type of medicine that I specialized in. I haven't stopped specializing in. I have over 24 years of experience with this type of medicine. It's called homeopathy. And there is one particular homeopathic medicine that seems indicated to help support and promote the health of the body and stimulate the body's ability to fix itself in the face of headaches which are of a certain nature. And headaches that show up in the morning after sleep or in the middle of the night after sleep generally respond very well to this homeopathic medicine. First I'm going to say it and then I'm going to spell it, okay? Because it's a Latin word and it's a little peculiar, the word. It's called lachesis immutus. You spell that L like Larry, A, C like Charlie, H like Harry, E, S like Sam, I, S. L-A-C-H-E-S-I-S. Second word, mutus. M like Mary, U. T like Thomas, U. S like Sam. That's M-U-T-U-S. Now, any health food store in the world will carry this. Any Whole Foods will carry this. You can even get it online at Homeopathy Overnight. There's a company called Homeopathy Overnight that you can order this from. So you want to get your hands on a homeopathic medicine called lachesis mutus, and you want to find it in the 200C strength. That's C like Charlie. So you need to order one multi-dose tube of lachesis mutus in the 200C strength. Now, it's going to come in a little tube. It's going to be about the size of your index finger. It's looks kind of like a lipstick container. And inside that tube is going to be about 100 little white pellets. And I'd like you to take 2 pellets under your tongue before bed for 5 nights in a row. 2 pellets under your tongue before bed 5 nights in a row. And you just suck on them like a Tic Tac. And the whole thing will cost you maybe $10 plus shipping. It's not much. So sometimes when we have a set of chronic health conditions, you've got osteoarthritis, you've got Klinefelters, and you've got the headaches. So we clean the diet up. We start on board with good medical nutrition, and in a couple of months, we get a leg up on the arthritis. Klinefelters is built in. That's a genetic thing. You're never going to get over that. But nonetheless, you can optimize your body's performance in the face of any genetic deficiency disease. So when we do the medical nutrition here, and a couple months go by and the arthritis is getting better, but the headaches haven't budged, well, There's only two things really that I can think about that are indicated here. Number one, you just need to give the medical nutrition more time because, you know, the body doesn't heal itself overnight. It heals itself, and it's a process, not an event. So it might just be that you need to give your body more time. But because you know Dr. Glidden, there's the intervention, the use of a homeopathic medicine. When we stall here, when we hit a kind of a holding pattern and improvement stops, often the correctly prescribed homeopathic medicine can really accelerate healing. Now, the great thing about homeopathy is when you take it the way that I tell you to take it, it can't produce negative results. There's only two possibilities here. The homeopathic medicine is going to help the headaches to go away, or the homeopathic medicine's not going to do anything. Can't hurt you if you just take it for 5 days. Can't hurt you even if you take it for 500 days, quite frankly. So it's a good guess. It's a good thing to do while you are continuing to take the nutritional supplements and continuing to maintain the diet discipline, okay? So give that homeopathic medicine a try. Call me back. You're turning into my favorite patient here because I love a challenge, and we're going to see what happens. But whatever else you do, Al, keep taking the nutritional supplements the way that you've been taking them because your body needs those, in order to fix itself completely. Everybody needs to be taking nutritional supplements every day. Nobody gets out of this one. Everybody has to take them. And once you get to a certain level of wellness, you'll be able to cut back to a maintenance program. But right now, I want to, keep the ante up here. Stay on the same dose that I recommended when you first began for a couple more months. Take the Lachesis mutis, see what happens, and I appreciate your trust in me. Thank you so much for the call. I'll be very interested to see what happens in the future. Herb is up next, calling with a question about weight gain. Herb, you're live with Dr. Glidden. Welcome aboard.
Oh, yes, sir. How you doing, Dr. Glidden?
I'm all right.
Yeah. I would like to know what would you recommend for that?
To help you lose weight?
No, to help to gain some weight.
Oh, you want to gain weight? Well, you got to eat more food. You got to eat more food. I mean, it's that simple.
Okay. Yeah.
I mean, how much food do you eat right now? You must not eat a lot. Do you drink a lot of coffee or something?
No, I don't drink coffee. I don't believe in that kind of stuff.
All right, so you don't do coffee or tea. Rarely do we get calls like this in the United States, right? It's kind of a peculiar thing, but here's the deal, because it breaks down the same way, whether we're coming at this from the North Pole or we're coming at this from the South Pole, it's the same thing. Your body, the only thing that makes anybody gain weight is they eat too many calories. So if you're trying to lose weight, you need to cut down on the amount of calories that you're eating, and if you're trying to gain weight, you need to increase the amount of calories that you're eating. Now, the problem in the United States happens because there are 10 foods that we've recognized as being bad for you, and as you are trying to increase, in your case, your food consumption, your calorie consumption every day, you really need to make sure you're not eating these 10 foods, right? So as long as you're not eating these 10 bad foods, I don't care what you eat, just eat more of it. And when it comes to eating more of something, you want to really just follow your body's indications, If you feel like having milk, have milk. If you feel like having cheese, have cheese. If you feel like having steak, have steak. Whatever. You just need to be following your body's lead, and once you kind of prime that pump and for 2 or 3 days you intentionally increase the amount of calories that you're eating, your body kind of snaps out of it and your appetite kicks into gear, and then your body starts craving food to its normal ability, right? So really, man, everybody that we talk to gets the Healthy Start Pack. So are you taking any of the longevity supplements?
I was. I'm just out of it right now.
All right. Mm-hmm. All right. So, it's one Healthy Start Pack plus 2 bottles of selenium per 100 pounds of body weight per month. That's a good start. And then really you just need to get on board with an understanding of what the 10 bad foods are. Don't eat any of those foods, and just increase the consumption of food that's not on the 10 bad food list that you like. I don't care if you have, 5 steaks a day. I don't care if you have 5 bowls of yogurt a day. I don't care if you have 25 eggs a day. As long as they're not on the bad food list, just follow your body's urging. And that's the best way to do it, man. Really, you need to just get a little bit more in tune with your body and see if that works. Does that make sense?
Yes, sir, it does. I appreciate it, Dr. Glidden.
All right, keep up the good work, Herb, and I appreciate your call. Gary's up next. We have a minute left, Gary. I'll take you over into the next segment, but we can get started now. Gary, you're live with Dr. Glidden. Thanks for calling.
Thank you, Doc. I was diagnosed with IBS 18 years ago, and last year I was having quite a bit of bowel troubles and stuff, and I had a CAT scan, and they said I had a stricture in my sigmoid colon, and so they gave me surgery for that. And since then I've discovered all this about the gluten and the problems with the IBS.
Yeah.
And so I've gone on a gluten-free diet, been about, month and a half or month and 3 weeks ago, and started on the Healthy Starter Pack. And I'm wondering after that surgery if I can still heal.
Oh, yeah, you can heal. And sometimes surgery is a good thing, right? If you've got a stricture in your bowel, sometimes you need surgery. If you've got a hernia that's popping out, sometimes you need surgery, right? If you have a little bleeding artery, you definitely need surgery. But, yeah, you bet. Your body can bounce back from any type of surgery. I'll tell you a story about that. Here's the rundown, Gary. The human body has a remarkable ability to fix itself, My nephew, years ago, he was a landscaper. I don't know what he was doing or how it happened, but he slipped the Achilles tendon. The Achilles tendon is that part of it attaches your calf muscle to your heel, right? And it ripped off of the heel, and his calf muscle rolled up, pretty painful, needed surgery to fix that. And his orthopedic surgeons, the people that performed the procedure, told him it was going to take at least 6 months for him to heal. Well, in 2 months, he was back to work because he was following my advice, taking these nutritional supplements, providing his body with the raw materials that it needs to fix itself. So your body knows how to fix itself. Your body wants to fix itself. All that is necessary most of the time in order for our bodies to fix themselves is for our bodies to have the proper nutrition. So it's really pretty straightforward. And this is also why I recommend, if it's at all possible, first of all, you can never unsurgery something, right? So what I recommend for people who have threatening surgery, depending, of course, on what the nature of the surgery is, that if you can put it off safely, without threat to your life for 90 days, put it off. Because maybe your body will be able to bounce back, but even if your body can't bounce back, because there are things that your body cannot bounce back from, there is a point of no return, and sometimes surgery is necessary. Sometimes you have to take the antibiotic or whatever, right? But even if you get to that point, undergoing surgery in a body that's been nutrified is much safer and much better for you because surgery is a stress. And it's the same post-surgery. Your body wants to fix itself, and you're going to up the ante with your body's ability to be able to fix itself if you strengthen the body from the inside out. So the recommendation here for somebody who's been diagnosed with irritable bowel, in order to support and promote the health of your gut, the recommendation, Gary, would be per month, 1 healthy digestion pack per 100 pounds of body weight per month. 1 healthy digestion pack per 100 pounds of body weight per month. 1 bottle of Maquis Plus, M-A-Q-U-I Plus, per 100 pounds of body weight per month. So the Maquis Plus has aloe vera juice in it. It's very healing to the intestinal tract, I don't know if you've ever had a burn and sliced an aloe plant open and squeezed the aloe juice onto the burn, but it heals the burn in record time. Well, it'll do the same thing to the inner workings of the gut. It really knocks down inflammation. So that's 1 bottle of Maquis Plus per 100 pounds of body weight per month. We also have a product, an anti-inflammatory product called CM capsules. CM like Charlie Michael, CM capsules. I would do 1 bottle of CM caps per 100 pounds of body weight per month, and I would only do the Mac-E Plus and the CM caps for a couple of months. That's not anything that you need to do all of the time, but it's really good in kind of an acute way to knock down inflammation that the body's dealing with right now. And, of course, for anybody who has any type of a gut problem, we're going to recommend an extra bottle of the Flora FX, the Ultimate Flora FX. Now, there is Flora FX in the Healthy Digestion Pack, but what the heck, why not take a little bit more of it? Because the more of the good bacteria that you deliver to your intestinal tract, the faster it will heal, okay? So that's 1 Healthy Digestion Pack, 1 Mac-E Plus, 1 bottle of CM capsules per 100 pounds of body weight per month, plus an extra bottle of the Ultimate Flora FX every month. Now, that's the nutritional supplement end of it, and that'll have your bases covered nicely. In addition to that, right, in order to support and promote the health of the gut, in this case, we really need to clean the diet up. So please, please, please go to fireyourmdnow.com, fireyourmdnow.com, opt in for my free newsletter. And when you opt in for my free newsletter, it's right there on the front page. I'm going to automatically send you my good food, bad food list and a little free video that tells you why wheat, barley, rye, and oats will kill you. And as far as you're concerned, Gary, wheat, barley, rye, and oats should be the Antichrist, man. You need to not even look at that stuff from now on, because as far as we're concerned, those foods are the root cause of irritable bowel disease. Ladies and gentlemen, it's good to be back. I'm Dr. Peter Glidden. I'm looking forward to taking your calls tomorrow on another edition of Fire Your MD Now. I'll see you then.